Actually, could you grab one of the models, Nora? Someone over there?
Those are huge.
Either one. Because if you get the side wrong, you're going to get the chamber name wrong. You can just hold it or set it there for me. You're going to get the chamber wrong, and you're going to get the valve wrong, right? So this is where I like to start with you. So this is my suggestion. Next week, when you come to a pig heart on the practical, identify which is the front and which is the back. To help you do that, I have written some things on the board that help me do it. Now we know that the apex points to the left, so when you look at it, the apex should point to the right, but it's really hard to see on these, so I don't think it's a very useful thing. The bottom two are more useful. So I'm going to pick up a pig heart at random. Now these pig hearts are already dissected for you, and each one has a different cut. So you want to see as many of these as you can, because they're all cut a little bit different. So just pass the pig hearts around to share. Don't do any more cutting, please. They're already cut. I need to say that. Okay, so let me get an easier one to start with. Yeah. So look at number 2 there. The aorta and pulmonary trunk are more visible from the anterior side. So Nora here has the model, and that's the anterior side, right? Mm-hmm. So the pulmonary trunk and the aorta, you can see them more on the front. If you can flip that over to the back for us. On the back, you don't see the aorta pulmonary trunk, right? So on here, okay, this is the pulmonary trunk. And sometimes on the pig hearts, the pulmonary trunk, it kind of runs almost horizontal a little bit. You see that? And this is what's left of the aorta. But they're more on the front, okay? Something else that can be helpful is number 3. The myocardium is higher on the anterior side. Let's look here, look on the front. Do you see this myocardium? Do you see how high it comes up? That's the anterior side. Flip to the back. You see how it's lower? Okay, so look at the pig heart here. The myocardium is all the way up to here. This is all myocardium, here down. Whereas, when I flip it over, look at the myocardium. Do you see what I mean? It's all the way down here, because these are all vessels and stuff. Do you see what I mean? Lower myocardium. If I keep the stick there, look at how much higher it is on the front. So use these tips. Look at as many pig hearts as you can. Start there. This is good, right? Helpful? Mm-hmm. Okay, so once I know this is the front, then I know this to be the right side and this to be the left side. Right? Because it's what it would be on me. Yeah? So that means that which chamber is this right here? Right atrium. But you see, if you use that mechanism of which side is which, it's easy. Right atrium. Down here is the right ventricle. This is the left side. So what chamber is down here?
Left atrium.
Lower. Left ventricle.
Okay.
Right? Okay, so I would suggest starting there. Once we open it up, right, you're going to see that this chamber is the left ventricle. Above the valve is the left atrium, right? What valve are we seeing here?
Bicuspid.
Bicuspid or mitral or left atrioventricular. Okay? We can see the chordae tendineae. You can see the papillary muscle. Deep in the ventricular walls, we can see the trabeculae carnae. If we compare the left ventricular wall to the right, which is thicker? The left. So that's another way of identifying the sides. If you can see both walls, the thicker one is the left, right? Couple things. There's one thing that we didn't talk about yet, and those are the auricles. It's on your sheet. Auricles, put the top back on for me. It gets its name because it looks like an elephant ear. But you see these flaps? The auricles are the flaps over the atria. Mm-hmm. And you get a good look here at how it's kind of like a flap. This is the left auricle, and this is the right auricle. In terms of function, okay, I have an analogy. You know you have like a wheeled suitcase, you know, in the airport, and one zipper opens up the top. But there's a second zipper, isn't it? When you unzip that second zipper, what does it do?
Makes it fatter.
It makes it pop up a little more so you can fit that extra pair of jeans in there. That's kind of like the auricles. So they kind of pop up and it allows the atria to fill with more blood. Do you see what I mean? Isn't that a good analogy?
Reservoir.
Yeah, but it just kind of pops up to allow more space to fill. Okay? All right, other things, the vessels. So when you're trying to identify the aorta from the pulmonary trunk, from the superior vena cava, look at the thickness. Arteries are really thick. Look at the wall here of the aorta. Thick, 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 okay? So if you see a thick vessel, you're gonna think artery. Whereas the superior vena cava, here's what is left of it. This isn't a very good one. Let me see if I can find another one. They chop off some of these vessels. Look at how big the aorta is, isn't it crazy?
Yeah.
Now this one, they've kept it intact more so you can see the 3 branches coming off of it. All right, let's find the superior vena cava. This is gonna be the right side, here. Here's what's left of the superior vena cava. So what my index finger's in. But look at the wall. Isn't it much thinner? Okay? So when you see thin wall, you're gonna think vein. Superior vena cava, thin walled. Aorta, an artery, thick walled, right? Okay. Something else you can do is shove these sticks through the vessels. This is a way to practice the blood flow through the heart, and it can help you identify the structures. So if I stick this through the aorta, so I'm in essence going in the reverse direction of the blood flow, what chamber is that going to go into? Left ventricle. And it does, right? Left ventricle. Because the left ventricle is going to pump blood out the aorta to the body, right? Whereas, what if I stick this through the superior vena cava? What chamber is that going to go in?
The right atrium.
Right atrium, right? So, we start from the beginning. This is the front because I see the pulmonary trunk and I see the aorta. Myocardium's higher, right side. So when I stick this through the, there it is, right? Okay? Lastly, looking for the valves. The AV valves are easy, right? It's on the left side, mitral or bicuspid. On the right side, it's going to be the tricuspid. What about the semilunar valves? If you look for the vessels, what vessel is this right here? Pulmonary trunk. It's actually split open for me, so I can get a look at the valve. So you see these 2 little flaps. Here's one of them. Just these 2 thin flaps. Pulmonary semilunar valve. Is that what this is? That is the pulmonary semilunar valve, correct. So it goes between the pulmonary trunk and the right ventricle. See how thin it is? Now what if I want to find the aortic semilunar valve? I can just look straight down the aorta. So if you look straight down that aorta, you're going to see a little flap of tissue. Aortic semilunar valve. Okay? The pig hearts can be challenging. My suggestion is to start with that, right? Because once you get the sides correct, the chambers and the valves are correct. Other things are pretty easy, you know? Like, let's see here. Can we find one?
And these are how the hearts will be dissected for our practical, right?
Correct. And I'm going to position the hearts so that you'll be able to identify the sides.
Okay.
Because you're not going to touch them.
Okay.
Because when students touch them, they get all messed up. But I'm going to situate it, and I may even have some sticks going through to strategically give you tips towards, right?
If we have questions as to where the sticks are pointing,
Look at the bicuspid valve. Isn't that great?
and that's the tendoni right there.
Chordae tendineae. And the chordae tendineae anchor themselves on the papillary muscles. Okay? No, please,
No, you're fine.
come see. That's the idea. I wanted to find one that had, yeah, this one. So So sometimes I can ask you questions where you don't need to know the side, right? What if I had a pin in here? What is this called?
The
Interventricular septum. But I'm going to choose that where we can see all three walls. This is the right ventricle wall, okay? The septum, left ventricle wall. 1, 2, 3.
Yep.
So we. Oh, it's fine. Just some dried blood. I could ask you chordae tendineae on any of them, right? I could ask you papillary muscle on any of them. Okay? One last thing, and then I'll shut up. The pulmonary artery and pulmonary vein. Pulmonary artery, pulmonary vein. I'm going to ask you those on the models. So, Nora, you're right here beside me. Can you show us the pulmonary veins? Maybe Laura can help you out. So I'm telling you, with the pulmonary vessels, it's reverse, right? Usually when you see red, you think artery. But the pulmonary vessel is only place in the body. So I just want you to, double check. Pulmonary vein, pulmonary artery.
So because the colors are because red is oxygenated blood and blue is okay.
And I'm going to ask you the pulmonary vessels here. I could ask you pulmonary trunk because you can see that, but the pulmonary artery and vein are just hard to see.
This is the pulmonary trunk.
And the pulmonary trunk splits into a right and left pulmonary artery. Correct. Well, the blue one is pulmonary artery.
Oh, yeah.
So the coronary vessels and pulmonary artery and vein model only. Everything else you might see on either. Okay, great. So the rest of the lab is just you with the hearts.